Seniors, if you're dealing with cold hands and feet, tingling and numbness, or swelling in your legs, stop ignoring these warning signs. These are symptoms of poor circulation. After age 60, this isn't just uncomfortable, it's dangerous. Poor circulation dramatically increases your risk of blood clots, stroke, and even amputation. But here's what most doctors won't tell you. There's one powerful drink that can improve your circulation within minutes by triggering your body's natural nitric oxide production. When you combine this drink with one simple 5-minute activity, I'll reveal at the end, the boost multiplies, restoring warmth and energy. Before we dive in, drop a comment and tell me where you're watching from. Hit that subscribe button and turn on notifications because I share life-saving natural health solutions like this every week. If you're dealing with circulation problems right now, type A1 in the comments. If you're watching for prevention, type 0. I'm Dr. Emily Carter, and I've spent years helping seniors over 60 improve their health naturally. Often medications don't work well for this, especially in winter. That's why I've adapted this powerful remedy specifically for you. First, let's look at the symptoms. The number one sign is persistently cold hands and feet, feeling ice cold even in a warm room. Second is numbness and tingling, that pins and needles feeling that happens all the time. This means nerves aren't getting enough oxygen-rich blood. Third is swelling, or edema, in your ankles or hands, caused by fluid accumulation. Fourth is leg pain or cramping when walking, known as claudication. Fifth is a surprising one, hair loss, thinning hair, or brittle nails, because hair and nails need blood supply to grow. Finally, there's restless leg syndrome, that uncomfortable urge to move your legs at night. If you have these, you need to act immediately. Why do you have poor circulation? Let's explain the 3 most important reasons for seniors. Number 1 is nitric oxide deficiency. Nitric oxide is a vasodilator produced naturally that opens up your blood vessels. After age 60, your body produces about 50% less than it did when you were younger. Number 2 is thyroid hormone disorders like hypothyroidism or Hashimoto's. Thyroid hormones regulate your metabolism. When they are low, everything, including blood flow, slows down. This is extremely common in women over 60. Number 3 is high inflammation. Chronic inflammation thickens your blood and makes vessels less flexible, creating a perfect storm for poor circulation. Now, let me talk about the powerful drink that addresses these issues. The first ingredient is beetroot juice. Beets are high in nitrates, which your body converts to nitric oxide. A 2018 study in the journal Nutrients found that beetroot juice significantly improves circulation in older adults. The second ingredient is fresh ginger. Ginger contains gingerols, which are potent anti-inflammatory compounds. It reduces inflammation in your blood vessels and has the property of heating your body from the inside. A 2018 study in Food and Function reported that ginger enhances peripheral circulation as a natural vasodilator without side effects. The third ingredient is pomegranate juice. Pomegranates contain polyphenols like ellagic acid, which promotes vasodilation. A 2014 study in atherosclerosis showed it increases natural nitric oxide production and protects your arteries from plaque buildup. Continuing with our ingredients. The fourth is turmeric. Its active compound, curcumin, is a massive anti-inflammatory. By reducing vessel inflammation, it promotes blood flow and helps prevent blood clots, which is critical for stroke prevention. Finally, we add lemon juice. High in vitamin C, it supports collagen synthesis for healthy blood vessels and boosts nitric oxide levels. Here is how to prepare this circulation-boosting drink. You will need a blender. Add half a cup of beetroot juice or half a cup of chopped fresh beets. Leave the skin on for nutrients. 1 tablespoon of pomegranate juice or a small handful of fresh seeds. 1 teaspoon of grated fresh ginger. Half a teaspoon of turmeric powder or an inch of fresh root. 1 teaspoon of fresh lemon juice. Half a cup of filtered water or coconut water for extra electrolytes. Blend until completely smooth. You can drink it as a smoothie or strain it through a fine mesh if you prefer a thinner juice. The best time to consume this is in the morning on an empty stomach. This is when your body is most receptive to nutrients after an overnight fast. Drink 1 glass, wait about 20 to 30 minutes, and then have your regular breakfast. This sets the tone for your blood flow for the rest of the day. Now for the bonus tip, the synergy secret. As soon as you finish the drink, perform 5 to 10 minutes of light movement. This could be gentle squats, using a chair for balance, modified jumping jacks, walking in place, or even arm circles. The drink triggers nitric oxide production, and the movement amplifies that effect several times over. Many people report feeling warmth returning to their extremities within just 15 to 20 minutes of this combination. However, we must consider safety. First, if you are on blood thinners like warfarin, talk to your doctor, as ginger, turmeric, and beets have mild blood-thinning effects. Second, if you have a history of kidney stones, be cautious with beets due to their oxalate content. Third, if you take blood pressure medication, monitor your levels closely, as this drink naturally lowers pressure. Finally, start with a half serving to see how your body adjusts. Your action plan is simple. Gather fresh ingredients, prepare the drink each morning, consume it on an empty stomach, and follow it with 5 minutes of movement. Do this consistently for at least 2 weeks. This isn't just about comfort. It's about maintaining your independence and preventing medical emergencies. Comment below and tell me which symptom you're hoping to improve. Please share this with a fellow senior. It could literally improve their quality of life. Until next time, take care of yourself. You deserve to move without pain. One often overlooked factor in poor circulation, especially for those over 60, is chronic dehydration. As we age, our thirst mechanism becomes less sensitive, meaning you might be dehydrated without even feeling thirsty. Why does this matter? Dehydration makes your blood thicker and more viscous, making it much harder for your heart to pump it through those tiny capillaries in your hands and feet. This is why I recommended coconut water for your circulation drink. It isn't just for flavor, it's packed with potassium and magnesium. Potassium acts as a natural counterbalance to sodium, helping to ease the tension in your blood vessel walls, which further lowers blood pressure and improves flow. Magnesium is often called the master mineral for circulation because it helps the smooth muscles within your arteries to relax. If you find that your legs feel heavy or lethargic, it's often a sign that your blood is struggling to fight gravity. By staying hydrated and maintaining your electrolyte balance, you're essentially thinning the blood naturally, allowing that nitric oxide we triggered earlier to do its job much more effectively. Aim for at least 8 ounces of pure water for every cup of coffee or tea you consume, as caffeine can sometimes act as a mild vasoconstrictor, narrowing those vessels we are trying so hard to open. While the drink works from the inside out, we can also use external temperature therapy to jumpstart the nerves and vessels in your extremities. For seniors, I recommend a technique called contrast bathing. You don't need a fancy spa for this. You just need 2 basins or your bathtub and a removable shower head. You alternate between warm water, not hot as senior skin can be sensitive, and cool water. The warm water causes your vessels to dilate, vasodilation, and the cool water causes them to constrict, vasoconstriction. This creates a pumping action in the small vessels of your feet and hands, manually forcing blood to move through areas that have been stagnant. Do this for 3 minutes with warm water and 1 minute with cool water, repeating the cycle 3 times. This is especially effective if you suffer from the numbness and tingling we discussed earlier. It wakes up the sensory receptors and forces fresh, oxygenated blood into the skin's surface. When you combine this with the ginger and beetroot drink, you are attacking the problem from both the internal chemical level and the external physical level. If you have neuropathy or decreased sensation, always test the water temperature with your elbow or a thermometer first to ensure it's safe. This simple 12-minute routine, done a few evenings a week, can dramatically reduce the swelling and ice-cold feeling that keeps many seniors awake at night. To take your circulation to the next level, we should look at a few synergists, nutrients that make your morning drink even more effective. One of the most important is L-arginine, an amino acid found in walnuts, pumpkin seeds, and turkey. Your body uses L-arginine specifically to create nitric oxide. While the nitrates in the beets provide the spark, L-arginine provides the fuel. I often suggest my patients snack on a small handful of raw walnuts in the afternoon to keep those nitric oxide levels steady throughout the day. Another powerhouse is vitamin K2. While vitamin C helps with the structure of the vessels, vitamin K2 helps ensure that calcium goes into your bones and stay out of your arteries. Arterial calcification is a major cause of the stiffness that leads to poor circulation in seniors. By keeping your arteries flexible, you allow them to expand and contract properly. You can find K2 in fermented foods like sauerkraut or certain cheeses. Lastly, don't forget omega-3 fatty acids. Whether from fatty fish like salmon or a high-quality algae supplement, omega-3s reduce the stickiness of your platelets. This prevents the microclots that often lead to that dull, aching leg pain. When your blood is slippery and your vessels are stretchy, circulation becomes effortless for your heart, which is exactly the goal we are aiming for after age 60. We rarely talk about the mind-body connection when it comes to cold feet, but cortisol, the stress hormone, is a powerful vasoconstrictor. When you are stressed, anxious, or even just frustrated, your body enters fight or flight mode. This pulls blood away from your extremities and toward your internal organs and large muscles. For many seniors, chronic low-level stress from health concerns or daily life keeps their hands and feet perpetually cold. This is why the 5-minute movement I mentioned is so vital. It's not just for the muscles, it's to burn off that excess cortisol. In addition to the movement, I want you to try box breathing while you drink your circulation mixture. Inhale for 4 seconds, hold for 4, exhale for 4, and hold for 4. This simple act sends a signal to your nervous system that you are safe, allowing your blood vessels to relax from their clenched state. Remember, your vascular system is lined with tiny muscles that respond to your emotional state. If you are constantly tensed up, your blood flow will be restricted regardless of what you eat. Pairing the nutritional power of the beetroot and ginger with a calm, relaxed state of mind creates the perfect environment for healing. This is about more than just a recipe. It's about creating a morning ritual that tells your body it's time to open up, relax, and let the energy flow. As we wrap up this masterclass on circulation, I want to emphasize the importance of tracking your progress. Many of my patients start seeing results in the first few days. The pins and needles fade, and they stop needing thick socks to sleep. However, the real structural changes to your blood vessels happen over the course of 3 to 6 months. I recommend keeping a circulation journal. Every Sunday, rate your leg pain, hand temperature, and energy levels on a scale of 1 to 10. You will be amazed at the trend line after a few weeks. I've seen seniors who were told they needed surgery for their varicose veins or claudication turn their lives around just by being consistent with these natural methods. One patient, a 72-year-old named Robert, couldn't walk to his mailbox without stopping because of leg cramps. After 30 days of the nitric oxide drink and daily light marching, he was walking a mile every morning with no pain. This is possible for you too. You have the tools, the science-backed ingredients, and the movement strategy. Don't let these symptoms steal your golden years. You've worked hard for your independence, now let's protect it. Remember, I am here to support you every week with more strategies like this. If you haven't yet, share your day 1 starting point in the comments so we can cheer you on. If you're going to try this circulation drink, comment below and tell me which symptom you want to improve most. Share this with someone over 60 who struggles with circulation. I'm Dr. Sarah Jenkins. Take care of your health, stay warm, stay active, and I'll see you in the next video.